Want to quit smoking or help someone you love quit? Consider joining the Year of Cessation movement. Joining us live to explain is Deyanira Cisneros from St. Peter's Health Partners Community Health Programs. Good afternoon, Dee.
Good afternoon, Courtney.
What is the Year of Cessation?
The Year of Cessation is a campaign or an initiative founded by the Center for Disease Control and Prevention organization. It's the Office of Smoking and Health, who is promoting the ability to help others quit smoking. Smoking, we know it's detrimental to the health, and we really want to help those we love to quit.
And what resources are available locally to those who are looking to quit, or who might be trying and struggling and having trouble quitting?
Well, primarily, we always promote the idea of talking to your primary physicians. Many of the insurances are covering these services that can help you quit with the use of nicotine replacement therapies. And also, we encourage that folks that are interested in learning more about quitting, that they contact the New York State Quit line, and that is the 866 New York Quits. And we will definitely share that number again in our feedback.
And how does Community Health Programs support this initiative?
We are a New York State Department of Health funded program, and the New York State, along with other providers, public health professionals, have joined forces in trying to promote cessation. We work with behavioral health, medical medicine, medical facilities, and so on, and trying to share the word of quitting and the benefits of quitting tobacco use.
What are some of the barriers to quitting smoking?
Tobacco is definitely a very addictive product. The nicotine is very addictive, and we understand that it is a hard habit to kick, which it is why we promote the use of therapy and medication to help you ease those cravings that are associated with the process of quitting tobacco.
And while adult smoking rates are at all-time lows, the popularity of e-cigarettes, really continues to soar. What is being done statewide to curb this trend, especially among youth?
Currently, the smoking rate among adults in New York State is at, as you said, at a low time. Currently 14.1%. But even though it's that low, you still have some rural communities where it's much higher, even a 28%. And as you mentioned, with the emerging trends of new tobacco products in the market, it makes that those efforts that we have achieved so much harder. The use of electronic cigarette, it has been marketed as a cessation device, and we have evidence that it is not, and it is definitely more prevalent among youth, a lot of times because of the flavors that are used in the liquids, and definitely it is very appealing to kids.
And what about, New York State has a new Tobacco 21 law, to prohibit sales of tobacco products to those under the age of 21. Can you talk a little bit about this law?
Yeah, we applaud the Governor Cuomo for taking this initiative and finalizing it. Just recently, it was signed into law, and effective would be that you will be required to show evidence that you are 21 or over to be able to purchase tobacco. And that is a great way of promoting tobacco control and cessation, because by delaying that process of using any tobacco products, we can hopefully prevent youth from starting to smoke. Evidence shows that the more you delay it, the much better it is, or the more likely that the individual will not be addicted to it or even start smoking.
Great. And again, we're talking about the Year of Cessation movement. We'll post more information online. And again, if you're looking to quit, you can always contact the New York State Smokers Quit Line. Thank you so much, Dee. We appreciate you taking the time to talk about this today.
Thank you.